Alright, so I'm going to be needling Lindsay's upper trap. So we're going to take a look kind of to start out here, just kind of see what we got for tenderness and for trigger points. So I'm just kind of pinching that muscle. And got some tight spots kind of right there. I can kind of feel that muscle just kind of twanging underneath my fingers there, so we're going to go right about there. Couple of key kind of safety things with it. Got to be wearing gloves. Gonna put rubbing alcohol on there, and then I'm just gonna put some rubbing alcohol on my gloves too, just so everything's nice and sterile to try to reduce any risk of infection. Anytime the needle is entering the skin, there's a small risk of infection with that, so I want to minimize that as much as possible. Rubbing alcohol on there. A little bit on my gloves, and we'll go right to that muscle there. I'm going to show two techniques. The first technique is just called pistoning, where I'm just going to kind of move that needle to manually stimulate that muscle, and we'll get a twitch response with it. After that, I'm going to use an electrical stimulator and just kind of show the differences between those two. So again, I'm going to kind of palpate, find that spot in the muscle where a little tender there. I'm going to kind of pinch, and then I'm going to set that tube up there, tap the needle in like that. And I'm just going to kind of enter the needle into the muscle there. Find that little spot. And then I'm just going to kind of piston it. You can kind of see her reaction. She kind of squirms a little bit there, but I also can kind of feel a little bit of a twitch response there with the muscle.
So why do you want that response?
That twitch response, most of the research behind dry needling kind of shows that that twitch response is associated with a lot of chemical releases, a lot of natural endorphins, which are going to help alleviate that pain at that trigger point site, as well as any sort of referral pattern that's coming from that trigger point. So that's kind of the key to a good treatment. So we did the manual stimulation with the pistoning technique, and now I'm going to use the stimulator. I've got the one electrode kind of just underneath the strap on her tank top here, just pressed against the skin. The other part of the electrode is going to be against the needle itself. So we're just delivering that current into that muscle there. Just kind of go until you see a good twitch response there. Is that okay there, Lindsay?
Mm-hmm.
Okay. What's nice about this too with the stimulator compared to the other technique is that other technique's a little sporadic. The twitches are not as rhythmic compared to this. The stimulator, it's a little bit more kind of predictable for the patient. And what's nice too is I can kind of change the level of intensity with it if the patient kind of gets uncomfortable with it. So if that were too much for her, then I can kind of tone that down a little bit, so we're still getting a good twitch response. It's just a little less intense and less uncomfortable for the patient.
And do you need a twitch response in order for it to be an effective treatment?
Yeah, that's kind of the goal for the treatment. Sometimes, I mean, like I said, that chemical change with that twitch response is kind of what we're shooting for. Even the presence of the needle within the muscle is enough to kind of change the electrical environment of it and can kind of help settle down that trigger point a little bit. Like I didn't talk it through, but I took the needle out there and then I just kind of pressed on and just kind of rubbed that a little bit there, just kind of give some tactile feedback in case that was a little uncomfortable there, just to settle that back down. You can kind of see there's a little erythema in through there. Most of that's actually really more from me pinching. A little bit of that can kind of come from the needling as well too there.
And I'm probably going to get redder than most
than average. So,
would,
let's see, we could do any other muscle
Is
groups
there an abnormal response or something that you may see or the patient may tell you that would be a red flag?
So some kind of adverse reactions could be that the patient might get kind of lightheaded if they have an aversion to the needles. Some people can pass out. Very unlikely. I've had one patient that I've needled who kind of reported kind of a lightheaded feeling. I just took the needle out. Luckily, they were in the same position here, a prone position, so I just had them maintain that position until those symptoms came down.
Okay.
For that session, I just that was the only needle that I placed that time. I talked to them about staying hydrated, staying fed prior to the treatment, and the next time through, we were a lot more successful. So,
Okay.
yep.
Excellent.
Talk about like hitting the nerve.